All right, so my name is Marcia Woodburn. I think have I met some of you? I think no, yes. And I'm a nurse practitioner. I took over for Leah Gaddicke, who was working here before me. I see patients from Dr. Cohan, Dr. Smoot, Dr. Rice, and Dr. Vlahovic. Sometimes intermittently, we'll kind of go back and forth between the two. And so, what I'm going to talk to you about today is living well with MS, as well as some symptoms that I typically see in the office. So, if you have any questions, as we're going through and you see a slide where you have a question, feel free to raise your hand. We don't have too many people here, so I'm okay just chatting as we go. So how do we manage MS? So one of the best ways that we can manage MS is to help prevent exacerbation of symptoms. So to do this, the National MS Society actually has a page called Living Well with MS, and they talk about managing diet, exercise, healthy behaviors, emotional well-being, spiritual well-being, cognitive health, work and financial life, home and leisure activities, and mobility and accessibility, and building and maintaining relationships. And then finally, as we go through these, I'm going to sum it up with the symptom management that I mentioned. So diet, what diets work best? We really don't know. There has been some discussion about the Mediterranean diet, the Walls diet, but no research has really shown us exactly what diet is the definitive MS diet. So typically, what I recommend is something that is, healthy meats, low-fat meats, fish, eggs, chicken, lean meats, really. And then the Mediterranean diet also emphasizes anti-inflammatory foods, including fruits, leafy greens, olive oils for healthy fats. And then again, the fish, seafood, dairy, and poultry in moderation. And then the Walls diet was also developed by a physician who actually had MS. This is sort of a modified paleo diet. The paleo diet is a diet that was followed before humans started farming. So that involves meats, fish, nuts, vegetables, and fruits. Walls adds also vitamins and some other behavioral activities like meditation and exercise as well. And she's actually written a book on the Walls diet that you can read if you'd like. And then exercise, the CDC currently recommends, and that's one of the handouts I have up front here. The CDC recommends that people with chronic health conditions and disabilities get at least 150 minutes of moderate intensity aerobic activity a week. Now, that can seem intimidating for some people who have some more significant physical disability concerns. So you can break that up into smaller pieces. So if you do 10 minutes at a time, 20 minutes at a time, and break it up over the course of those 7 days of the week, you can get some of that activity done. Now, if you're really challenged, you can do, if you do at least 20 minutes of low to moderate activity 3 days a week, that's just as acceptable. So I always tell patients any kind of physical activity is better than none. So if you can get an arm exerciser or a foot pedaler, and you're sitting on the couch and do that, that is exercise. That's getting your heart going and also maybe reducing your risk of falling. So talking with physical therapy can also be helpful because they can give you some tips and tricks on how to get exercise in and tailor it to your specific disabilities. Aquatherapy is also good, helps with balance. Matter of Balance and Tai Chi are also good programs to consider. Matter of Balance is often offered at senior centers, and it helps with fall prevention. Silver Sneakers is another program recommended by the CDC that's offered at many recreational centers for people to stay more active, and it also includes fall prevention. And then again, working with PT and OT. And Occupational therapy is slightly different from physical therapy in that it helps you with daily activity. So it helps you doing your laundry, cooking your food, just all the daily activities that you need fine motor movement with, and gives you some recommendations on assistive devices that might be helpful for you throughout the day. Sometimes grabbers are helpful. And they have many, I had someone wearing hand rings on her fingers to help keep her fingers straighter. That was provided by occupational therapy. So there's many, many things that I haven't even thought of that occupational therapy and physical therapy can offer, so that it can be quite helpful. Healthy behaviors. I talked a little bit about this. Healthy behaviors, the main things that I focus on is limiting smoking and reducing alcohol intake. Smoking can be linked to exacerbations of MS and prevent symptoms from improving. So if you can limit your smoking, that will go a long way towards helping prevent relapses, or pseudo relapses, I should say. And getting good quality sleep. Anything that you can do during the day that is kind of self-care, good nutrition, good sleep, staying well hydrated, all of those things help reduce your risk of pseudo relapse. And when I say pseudo relapse, that means an exacerbation of symptoms that you've already had. Okay, that's different from a relapse, which is where you have new symptoms that last 24 hours, and that can be an indication that you may have a new lesion. Okay, that's the difference. And then I also had some websites here listed for resources from Harvard, which give some information on how to create better sleep quality, especially if people are having insomnia, and kind of how to address adjusting your sleep schedule to get better quality sleep. So if you want to see this, sometimes it's a little bit hard to see that with the green there. I'm happy to give you that information in a MyChart message or something. So emotional well-being, how does this impact MS? So I talked a little bit about relapse versus the pseudo relapse. The pseudo relapse, again, is the worsening of old symptoms. A relapse is a concern for new symptom and new lesion. So when you are stressed under any situation, it could be mental stress, physical stress, and that could include infections, work changes, living changes, family changes. Any of those kind of stressful situations can lead to a worsening of symptoms. It basically overwhelms the pathways in your nervous system and brings those old symptoms back. So you want to also maintain a healthy emotional well-being, because that helps motivate you to be healthy, to eat healthy, to sleep well, to take care of yourself. And it also influences how you exercise. Do you feel motivated to get out and go exercise? So you want to make sure that you're staying emotionally well. Your relationships can also be impacted. MS can be a life-changing experience. Everybody's path is different, and everybody's response is different. So it's important to maintain your emotional well-being so that you can try to maintain those connections with the people that are important to you and can give you the support to manage your new diagnosis. And then overall life enjoyment. If you're miserable, if you're emotionally not well, you're not going to have as much enjoyment in life. So how do you manage this? You focus on the positive, you stay centered, you manage stress. You could consider counseling. Some people consider antidepressants in certain situations, and it could be short-term or long-term just to get you through situational issues. And then solution focused. You want to stay focused on solving the problem. What can you do to get over whatever it is that you're facing at that time? And then be kind to yourself. Pay attention to your mood. If you're not feeling well that day, rest a little bit. Take some time for yourself and do some self-care. People, as they progress through MS, often will identify what triggers their symptoms or causes pseudo relapses. And so you can, as you learn your body, you can figure out when you need to take breaks or what you need to avoid, or tips or tricks that you can take to help reduce those stressful situations. And then again, maintaining social connections and relationships and keeping in touch with the providers, your providers. We're there to help you. If you're going through a difficult time, please feel free to reach out to us. We have case managers. We have, social supports to help get you through whatever it is you're dealing with. And so spiritual well-being is also sort of part of the emotional well-being. The Chinese characters, I mentioned this, for crisis are danger and opportunity. So you can see this new diagnosis potentially as an opportunity to become more self-aware, to find meaning in the challenge of the diagnosis, to discover inner strengths and resources, to become better balanced in your life, and to develop creative strength. You may have to change how you live your life. Some people may not. But being open to that, if it does happen, can be quite empowering, and you can find very different ways to live that you might not have anticipated before. And then also connecting with whatever it is that makes you feel spiritually fulfilled, whether it's connecting to nature, art, music, and deepening relationships can also come from this diagnosis as well. So basically find what gives you meaning and helps you feel calm, so that you can use that at times where you're not maybe feeling as well as you would like to be. Cognitive health. So 65% of people with MS may experience some changes in cognitive functioning. And this is most commonly related to the speed of information processing, memory, and attention. Cognitive reserve is your intellectual enrichment that comes from education and stimulating work and leisure activities. Anytime that you're able to build those things, it helps to lessen or slow the impact of disease or age-related changes. So ways you can do that is you can read, you can do creative writing, you can journal, handiwork or other hobbies, board or card games, drawing or painting, crossword or jigsaw puzzles, learning a new language or playing a new instrument, anything that kind of works your brain to learn something new is developing new pathways and helping build that cognitive reserve that's going to help lessen your risk of cognitive decline, either from MS or from other issues. So it's always good to keep those creative opportunities going. Work and financial life is also another thing to consider as you move forward with your diagnosis of MS. Again, MS is very unpredictable. Everybody responds differently to MS. So it's helpful to do a personal financial inventory of income, assets, debt, insurance coverage, employment benefits, disability benefits options, other financial resources. And then you want to fast track any legal planning, redefine your retirement. It may be that you get into a situation where you want to retire a little bit sooner than you would have otherwise. And it's helpful to kind of have that planning in place so that if that does occur, that you are prepared for it. And then also consider mortgage options to protect your home. You want to make sure that if you do need to retire early or adjust your work situation, that your housing is protected. So anything you can do to kind of keep yourself financially well and housed is beneficial to do before that may occur. And hopefully it will not. But if it does, you have your plan. And then also setting short and long-term goals is helpful. Start an emergency fund, work with a professional. There are Social Security attorneys. There are also financial planners and accountants that can be helpful for you. And then we have a case manager in our clinic that can often help with people with work-related questions if those come up. And then also there's an MS navigator on some of the national societies that can also help you as well. And I have information, we have that in our clinic that we can get to you if you need it. Or you can look online at the National MS Society as well. Home and leisure, again, I talked a little bit about housing already, but modifying your home, that's another thing to consider. Make sure it meets your needs. Is everything that you need on the first floor? Do you have trouble, say, going up and down the stairs? Those things could be helpful to address. Occupational and physical therapy can sometimes do home assessments, especially if you want to avoid falls. And so those can be quite helpful. And then emergency and disasters, make sure that you have a plan. Some of the medications, may require you to have doses every day, and some just once a month. So make sure that you have a plan. If you have an emergency come up, do you have enough to get you through a couple weeks, or a power outage, or a trip across the country? Make sure you have a plan in place for those sorts of situations. And travel, recreation and leisure. Make sure that you have mobility aids with you if you need to. Make sure that you have a prescription for your medications if you need to travel with those. And then know your personal limits. What can your body do? Do you need assistance getting to and from a plane? Do you need assistance with luggage? Do you need assistance with temperature changes? Sometimes their symptoms are exacerbated in high heat. So being prepared for all of those things can be quite helpful to avoid troubles. And then mobility and accessibility. Again, make sure your home and workplace are accessible, and do any modifications necessary to help yourself. Physical therapy and occupational therapy, again, can sometimes help with that. And staying mobile, as I mentioned earlier, any kind of movement is helpful. Anything that you can do to get yourself mobile, that helps also prevent against osteoporosis as you age. And then get the right technology and equipment. Again, occupational and physical therapy can be key to giving you some of the adaptive devices that you might need to keep yourself active in life. And again, we have case managers and MS navigators and PT and OT that I mentioned. So relationships, one of the things that I discuss with people sometimes is work relationships. When do you disclose your diagnosis? How do you disclose your diagnosis? So consider that once the information is out there, it is out there. So keep in mind what is in your own best interest, confiding in people, those that you trust, and continue to give and receive in your relationships. Intimacy can sometimes be impacted with the symptoms that can come from diagnosis of MS. So it's important to keep communication open with your partner. It's important to discuss it with your provider in the case that you're having any intimacy issues at home. And there are medications, there are counseling that can be done for that. There's a variety of things that could be done to help manage those things. And then also considering when and how to talk to children can be quite helpful. So to go in, I'm going to start now. This is a little bit of a busy slide, but I'm going to start talking about some of the most common symptoms that I see in the clinic. So bladder dysfunction is a common symptom. You can have overactive bladder. The medications that we use are typically anticholinergics. There's oxybutynin or ditroban. There's sulfenicin or Vesicare, tolterodine or Detrol. And it can take a few weeks to see some effect with those. And the most common side effect you could see is dry mouth or constipation. The other option would be Myrbetriq, which relaxes the bladder muscle. It can increase the amount the bladder holds. It may also increase the amount that's urinated, and may increase blood pressure, nausea, diarrhea, constipation, dizziness, and headache. So there are some symptoms that can be side effects of this medication. And then Botox, if overactive bladder is not responsive to some of the typical medications, we may go to a urologist who can actually inject Botox into the bladder to help relax and paralyze the bladder. And people typically get that 1 to 2 times a year, and it can be quite helpful for some people to reduce the overactive bladder. Hesitancy and retention can also occur. The 5-alpha reductase inhibitors stop the growth or shrink the prostate and help improve urine flow, so that can be helpful for men. The dutasteride and the finasteride are medications in that class. And then the alpha blockers, they relax the bladder, neck, and the prostate muscles, making it easier for the patient to urinate. And those medications include doxazosine, prazosin, Cialis, Flomax is a very common one, terazosin, alafuzosine, and silodosin. The last two I don't really see too much, but those can be used. And then the 5-alpha reductase inhibitor and an alpha blocker together may actually give better effect. Now, when I see patients in the clinic, I may start them on Vesicare or Myrbetriq or Flomax, but often when it gets a little bit more complicated in this area, I'll refer people to urology. So urology can give more detailed information and specific medications to the patient to help address the issue. And then also pelvic floor physical therapy and urogynecology can be quite helpful for women dealing with pelvic or bladder issues. And so those are referrals that I often make in the clinic. If someone, because we have medications in MS that can reduce or that can increase your risk of infections, we do sometimes have people that have chronic urinary tract infections. And so in those instances, urology can also see those people as well. And sometimes we start people on prophylactic antibiotics in those cases. Constipation, slowing of the bowels can also be a or a symptom of MS. To deal with this, we will often focus first on non-medication option, mobility, hydration, adequate fiber in the diet, those sorts of things to help encourage proper bowel movements. If those do not work, we may go to stimulant laxative or stimulant medications like Bisacodyl or Senna or osmotic laxatives, including polyethylene glycol, which is Miralax, or milk of magnesia, lactulose or mag citrate. Lubricating enemas can also be used, such as fleet enemas, and then bulk forming medications such as Metamucil or Citracel or Fiber or Bran. Those are things you can get over the counter or through your diet. And then stool softeners, those don't necessarily make you go, but they can make the stool a bit softer, so easier to pass. And that's includes medication Colace or docusate sodium. Symptoms of fatigue are also very, very common with patients. Now, fatigue is kind of a non-specific symptom, and people can have fatigue in any with any chronic medical condition, with general daily activities, people with young children, various circumstances can increase the risk of fatigue. So because the stimulants that we use for fatigue have side effects, we like to start first with looking at behavioral aspects of sleep. So we talked to you about snoring. Do you snore at night? If you do, then we might want to do a sleep study to rule out obstructive sleep apnea and possibly a CPAP, and the need for a CPAP. Is it stress related? Are you having, issues at work? Are you having other, various life changes that could be impacting your ability to sleep? In which case we might talk about counseling. Or cognitive behavioral therapy can sometimes help you adjust your sleep schedule to help better get a better quality and quantity of sleep. And then also minimize sedating medications. A lot of patients that we see are on muscle relaxers for spasticity and neuropathic pain medications like gabapentin and Lyrica, which can cause sedation during the day. So if people become sleepy during the day and then they take a nap, then their nighttime sleep may be disrupted. So we talk about trying to balance the symptom management with the use of the medications so that we can have the best quality of life for the patient. And then medications, again, the stimulants are used as a last resort. The stimulants have, in research, really not been shown to be too helpful for patients with MS. And it may be that they just provide a placebo effect. So we really want to weed out first all these other behavioral pieces before we move on to a stimulant. And in many cases, we do move on to a stimulant, and it can be quite helpful for people if it's needed. Another thing I want to mention too is that again, Harvard, I got much of this information from Harvard. And so treating fatigue, exercise can also be quite helpful. So just even 20 minutes, 10 minutes, a little bit to kind of get that brain active can help you go to bed a little bit more easily in the evening. You don't want to do exercise within about 4 hours before you go to sleep, though. Otherwise, it may keep you awake. So doing something in the morning or early afternoon can be quite helpful. And then again, eating for energy, using caffeine wisely. Don't drink anything, in the evening or later evening, and then limit alcohol intake, stay hydrated, reduce and control your stress as well. Spasticity, I mentioned baclofen. So spasticity can be managed a couple different ways. So again, we like to avoid medications if we can. So we usually start with physical therapy, recommendation for stretching before you go to bed and after you wake up can be quite helpful. And then also magnesium glycinate, 200 to 500 milligrams daily. I usually recommend that people take the magnesium at night because magnesium can also be used to help with sleep. So it can be helpful for both things. And then if those are not effective, if those are not helpful, then we move on to the baclofen, the tizanidine, and in rare instances, if patients are not responsive to those medications, then we may move on to Klonopin, which can be quite helpful for some people. And neuropathic pain is, I think, neuropathic pain and spasticity are kind of right up there in the very commonest of symptoms that I see. And for neuropathic pain, we can consider anticonvulsants, gabapentin and Lyrica, antidepressants such as Cymbalta or amitriptyline. Occasionally gels will help, like diclofenac or capsaicin or lidocaine gel. Capsaicin has a heat to it, so when people put it on, it can cause a sensation of burning, and some people don't like that sensation, and so we switch to something else. You can also try lidocaine patches. Sometimes those are helpful. Anything that's kind of a distraction to the pain can sometimes be helpful. And you can see here too, this is a good example that sometimes medications can be used for dual purposes. So sometimes when we see patients in the clinic, how we decide on the first medication that we start is based on their overall picture. Maybe we have a patient that is depressed as well as having some neuropathic pain, and then we might go right to Cymbalta for that first medication to start. And then headaches and migraines are another common symptom that I see with MS. If it is a complicated situation, I will just refer over to our headache colleagues. for additional management. When we see patients in the clinic, we'll talk again about stress reduction, sleep, adequate hydration, and then also for women, especially going through stages of menopause, sometimes headaches can increase in frequency. So we'll talk about maybe going to see a gynecologist or OBGYN for evaluation of hormonal adjustments. So that could be another option. And then CoQ10, 300 milligrams daily or 100 milligrams 3 times a day has been seen in research to sometimes help prevent migraine occurrence. So we'll often recommend that. B complex as well can also be quite helpful. And then medications including beta blockers with the alls, the propranolols, and can sometimes be helpful. Antidepressants, including amitriptyline and venlafaxine, can be helpful. Anticonvulsants, again, such as valproate or topiramate, can be helpful. Topiramate I see fairly regularly in the clinic. And then injectable medications such as Ajovy, Aimovig, Emgality, or oral options, including Nurtec or Qulipta, can be helpful if the other medications are not helpful. So what I would say about the Ajovy, the Aimovig, the Emgality, the Nurtec, and the Qulipta is those often require prior authorizations. And so those can sometimes be a little bit more difficult to get. So we usually use those after some of the other medications have not been as effective. And then finally, Botox injection, depending on the type of medication, or I'm sorry, the type of migraine that you have or headache that you have. Occipital migraines, sometimes they can do an injection in the back of the neck that can sometimes help prevent those migraines. And those can be very helpful. So it really depends on what type of migraine that you have or headache that you have. And as I mentioned, if it does become more of a complicated migraine situation, we'll refer you directly to our headache colleagues. And another symptom, which can be quite painful, is trigeminal neuralgia. So it's a pain in the side of the cheek, the mouth area. When patients have this pain, because it is so painful, the ability to eat and drink can be impaired. And so we really want to watch those patients to make sure that they're eating and drinking and not losing weight. If we have someone who's quite frail, this can be a bit of a challenge. And our first line of therapy is usually carbamazepine or oxcarbamazepine. And then anticonvulsants would be a second, like the gabapentin or Lyrica would be a second line. And then you want to make sure you stay hydrated and eating during that. And it can sometimes take a little bit of time to get that trigeminal neuralgia under control. And we have to titrate with the oxcarbazepine or the carbamazepine to get that symptom under control. So it can take some vigilance. And then numbness is another thing that I come across as well. Numbness and tingling sometimes can turn into the neuropathic pain, which is the pins and needles type pain. Some people do show up with just numbness though. And unfortunately, there's not really too much we can do for numbness. Some people have trouble picking things up. And in that instance, we'll send them over to occupational therapy that can be helpful to help them learn how to maneuver through daily activities and give them assistive devices or adaptive devices if needed. But unfortunately, there's not too much to do for that actual sensation. And then weakness and imbalance, again, is a common symptom. You may see with people with MS, weakness or imbalance can occur because of MS affecting one or both legs. Physical therapy can be helpful. We want to avoid falls. And this is especially important in our older population because we get more concerned about osteoporosis and falls with hip fractures and other types of fractures. So we want to help avoid falls with weakness. So we'll often send people to physical therapy. And then if you are having dizziness that's contributing to the imbalance, we'll talk about vestibular therapy. There's something called the Epley maneuver, which can be quite helpful for people with benign paroxysmal positional vertigo, which is dizziness that occurs when you move your head. And that maneuver itself can actually reset the crystals in your ear and resolve that symptom. But you have to have that particular type of dizziness in order for the epilepsy to be helpful. But sometimes vestibular therapy can be quite helpful in those situations. And then meclizine is another thing that can be helpful as well. People take it as needed to help with the dizziness or vertigo. And then over-the-counter options sometimes are useful, but they can be sedating sometimes. So you want to keep that in mind if you're taking baclofen or muscle relaxers or some of the anticonvulsants, which can be sedating. And then ENT referral can also be helpful too. If there's something that is going on vestibular in the inner ear, sometimes ear, nose, and throat referrals can sometimes be helpful. And then another thing that can occur, especially for people with histories of optic neuritis, is blurry or double vision or field cuts. So we talk frequently about that and make sure that people with MS have an ophthalmologist. So an ophthalmologist is different from an optometrist. An optometrist is the person who sees you for glasses or contacts. The ophthalmologist is more of a medical doctor that can look more deeply at the eye and at medical conditions of the eye and help evaluate you for optic neuritis if you are one of the people that does have that. One thing with MS and symptoms is not everyone has every symptom. So it's really an individual thing. When we see people in our clinic, I often will run through a list of symptoms and we just kind of go through and I figure out what, that individual patient is having. And then we kind of try to figure out what our plan is to either modify medications or add medications to their plan. And then this is a list of the resources that I have up here. If you want to take a look at those, you're welcome to take that list. It's very, very tiny on the screen, but there is some information on how to get in touch with the MS Navigator at the very bottom. And unfortunately, I did notice today when I was looking that the MRI assistance program is no longer accepting requests right now. So I'm looking at some other options that hopefully we can get for people for MRI assistance. Does that mean yes, financial MRI assistance. Yeah. So that kind of sums up in a nutshell the symptoms that I see when I see patients in clinic.